Coming soon, Not All In by Dr. Tiffany D. Joseph. Releasing March 11th, 2025. What happens when immigrants are left out of the healthcare system? In Not All In, Dr. Tiffany D. Joseph unpacks the stark realities of healthcare disparities for immigrants in the U.S., exposing systemic inequities and the urgent need for reform. A must-read for policymakers, scholars, and anyone passionate about healthcare justice. Pre-order now and save 30% with code HTWN. Available on JHUP Press or Amazon. Secure your copy today.
Welcome to a new episode of Badly Governed. In today's show, we dive into a critical conversation inspired by the 2024 U.S. election results and the timely book by Dr. Tiffany D. Joseph, Not All In. This important book takes a close look at how race, immigration, and healthcare intersect, revealing the deep-rooted challenges that keep immigrant communities from getting fair healthcare, even with reforms. With a new president known for his anti-immigrant views, our chat with the author is set to be especially revealing. We'll discuss how today's political environment impacts these issues and what it means for immigrants nationwide.
Keep your soul intact. Don't let nothing hold you back. Your soul intact.
Dr. Tiffany Joseph is Associate Professor of Sociology and Internal Affairs at Northeastern University. She researches and teaches about race in the U.S. and abroad, migration in the Americas, immigrants' health and healthcare access, and the impact of policy on people's lives. Dr. Joseph is the author of two books, Not All In, Race, Immigration, and Healthcare Exclusion in the Age of Obamacare, and Race on the Move, Brazilian Migrants and the Global Reconstruction of Race. And her research has been covered in media outlets like The Atlantic and Newsweek. Welcome to another episode of your favorite podcast, Badly Governed. My name is Lige Lahens. Today, we have the great pleasure of meeting with Dr. Tiffany Joseph, who will discuss her new book, Not All In. Welcome, Dr. Joseph. Thank you for being a guest on the podcast.
It's a pleasure to be here. Thanks for the invitation.
Of course. Your book addresses a critical issue in today's political climate. It explores how race, ethnicity, and immigration status, and something in your book that you refer to as racialized legal status, shape healthcare access in the United States. Could you give us a brief overview of how the U.S. healthcare system operates through these lenses?
Yes, so basically the concept of racialized legal status really tries to account for the intersection between race, ethnicity, and documentation status in shaping people's lived experiences in the broader society, but specifically within the healthcare system. And in my book, I argue that one of the things that immigrants experience is discrimination in policy on the basis of documentation status, where there are lots of exclusions written in law and in policy that actually limit access to public benefits and social services, like healthcare, for instance, because of someone's documentation status. And so that applies to undocumented immigrants, but what's not commonly known is that that also affects other non-citizens. So for instance, you could be a green card holder who's here for less than 5 years with that status, and you are also excluded from being able to apply for things like Medicaid or receive Social Security benefits, even though you are a documented undocumented tax-paying immigrant until you have that status for 5 years. And so the point of racialized legal status is to really try to shed light not only on this explicit discrimination based on documentation status of all non-citizens, not just the undocumented, but also in terms of taking into account the role of the history of structural racism in the United States and how it has been a really insidious part of every aspect of our lives, people's engagement with institutions, with other people. And so within the book, I really try to shed light on how racialized legal status affects people in the healthcare system at 3 different levels. First, at the macro level, in terms of thinking about through policies that get written and legislated and then implemented because of those restrictions I already mentioned in law already on legal status that immigrants experience, but also in terms of implicit ways in which race and ethnicity sort of shape the lawmaking process. So, for instance, research has shown that when politicians are debating whether or not to pass certain legislation, they're often thinking about the race of the potential beneficiaries of those policies, and then that probably shapes the ways in which they decide to vote on particular legislation. So that's an example of how a more implicit way that structural racism shapes policy making alongside the more explicit ways that documentation status does in terms of policies. Those policies, once they're implemented, they have to get carried out in some way. And that usually happens at the meso level, where, let's say, people want to sign up for Medicaid. You have to actually file an application, submit proper documentation material to be able to enroll. And usually you have to engage with some government bureaucrat at a Medicaid office, or some space at the meso level to be able to sign up for that particular service and then to be able to use it. And so that's another way where racialized legal status can shape people's experiences, because oftentimes these bureaucrats have some discretion in the extent to which they sort of say, oh, you absolutely have to do this or you don't have to do that. And some groups of people might be more likely to experience more rigid experiences with those bureaucrats in those enrollment processes. So that's how racialized legal status could play out at the meso level. Another way it could play out at the meso level is in healthcare institutions, for instance, when people go to try to receive medical and healthcare services. If their providers, might take a look at a patient and figure, oh, this person, it seems like they might be from a low-income background, or this person, looks like a person of color to me, then this could shape sort of the engagement or the interaction between the provider and the patient in that healthcare setting. And so we also know that in terms of research that healthcare providers also have implicit biases on a wide range of social factors that they also take into account when they engage with patients that can have negative impacts on health outcomes for patients. So that's the second way that racialized legal status can play out at the meso level. And then finally, at the micro level, I argue that racialized legal status shapes people in their engagement with other people. So in their everyday lives, if you're on the T taking the subway, and someone, sort of figures, oh, that person looks like an immigrant, maybe they're in this country illegally, or they don't have documentation status because this person looks like they are of a certain racial or ethnic background. They could become the basis or the target of some sort of racial discrimination or racialized legal status discrimination. This could also play out too in terms of the racial profiling example in terms of issues of law enforcement, with particular populations being targeted and singled out on the basis of them looking suspect or like they don't belong in the country or that they look like they're immigrants, and that resulting in people being targeted or stopped in particular ways. And so within the book, I really try to highlight how racialized legal status plays out in people's lives from these different perspectives, these different levels, the macro, the meso, and the micro level within the healthcare system over the course of the time period from 2012 to 2019, when I conducted the research as a wide range of immigration and health policies were being implemented or considered with regard to within the context of Greater Boston, and how those policy changes and shifts over time from 2012 to 2013, from 2015 to 2016, and also in 2019, how they shape people's experience, particularly immigrants of color experiences, navigating the healthcare system and some of the negative implications of that.
Right. So, out of curiosity, did your research also look at other variables such as sexual orientation or gender identity?
So I didn't focus as explicitly on sexual orientation. In terms of gender, my goal was to recruit an equal number of men and women for the study. But oftentimes, and this has been documented in other research, that women tend to be more likely to participate in research studies than men. So I was able to interview men and women each year of the study in terms of the immigrant sample. But women tended to be the group that I was able to recruit and interview more of for the study.
All right. Well, thank you. Thank you. Now that we have a better understanding of the broader healthcare context through the lens of these different these different concepts that you just explained, let's dive into how government policies, as we are currently experiencing in the current climate, particularly those under the current administration, have influence or will influence access to healthcare for immigrants. Let's begin by discussing how this new government policies, particularly Trump's immigration policies, may make it even harder for immigrants to have access to healthcare. In your book, Not All In, you explored how race and immigrant studies plays a key role in the challenges that immigrants face in this country, especially those without proper documentation. So how do these policies that are coming about continue to exclude immigrant populations across the country, but more precisely in Massachusetts, from the healthcare system? And with Trump's anti-immigrant stance, what changes might we expect that the healthcare system will need to make moving forward? Like, how will healthcare leaders going to deal with this issue?
Well, I mean, that's a really good question and a really difficult one to answer at this stage, because I feel like we're 3 days into this new administration, the second Trump administration, and there have already been so many executive orders specifically passed around the issue of immigration that I think will have detrimental and life-threatening consequences for immigrants, not only in Massachusetts, but across the country. So I want to, preface my comments by saying that from the forefront. And just in terms of some of those executive orders, I think I'll highlight a couple of them here as we're talking before I talk a little bit more about what I guess healthcare leaders could do. I would say probably one of the biggest executive orders that we've been hearing about is the one around birthright citizenship, which is a constitutional amendment that was, implemented after the Civil War to ensure that the children of enslaved or of the formerly enslaved African American population would be considered and recognized as citizens. And so that had implications for immigrants coming to the country after that in terms of establishing birthright citizenship, essentially as the law of the land. And so this birthright citizenship policy, or I should say executive order, if it is able to be implemented within the period of 30 days from which it was signed, granted there have already been legal challenges to it, the implications of that would just be significant for healthcare and healthcare access, particularly if we think about, let's say, pregnant mothers who are not citizens. And again, at least in terms of my reading of the executive order, it seems like this extends not beyond undocumented individuals, but also individuals who are here on certain types of visas. So tourist visas, student visas. So let's say you're an international student, a graduate student here in the United States and you end up, you decide you find out you're expecting and you have your child, that child would not be a citizen of the U.S. if this executive order were to come to pass. And so what that would mean is that a lot of the rights and privileges and benefits that citizens are entitled to, if you need something like Medicaid, for instance, if you're low income, your child would not be eligible for that. If you need subsidies through the health exchange, let's say if you're middle income background, for the current the health exchange that was set up through the Affordable Care Act, you would not be eligible for that either. And so it really has the impact or the potential to significantly impact not only the ability to access health coverage, but then also health care. The other thing that I want to mention, too, is that there are also other immigrants who have either temporary protected status, asylee status, or refugee status. And those, I believe, groups are also at risk of being affected in terms of health care, particularly if the Trump administration decides to end temporary protected status for certain countries. And also, it's been clear in terms of the executive actions that have been taken at the border that the ability to be able to come to the U.S. and apply for asylee status is no longer an option, currently, at least coming through the southern border. And then also, I was reading earlier, I believe today or yesterday, that in terms of, let's say, people who applied for refugee status and were approved to travel to the United States under that status, another type of protected status that also entitles people to some types of health care and other public benefits after arrival, that those people will not even be allowed to come to the U.S. at this point. And so for people in these other categories that are documented but are not citizens, their ability to get access to particular health coverage options that, that typically there have been some provisions for those types of immigrants under that status, that also goes away. And so what that means is that if people don't have access to adequate health coverage, then they're likely not going to be able to get adequate health care. We know that in the United States, compared to our peer countries, our health care costs are the most expensive, but our returns for those costs are very limited. But often, having access to coverage usually helps people get access to care and vital preventive services that can have a potentially positive impact on health outcomes down the line. So if all of these executive orders that I've already talked about, just those two, are, fully implemented, then the healthcare access for these populations is significantly at risk. And it would also be important to mention that immigrants don't live lives as individuals. Many of them are in family units, and some people are in mixed status families. And so the implications of some immigrants, either undocumented or non-citizens, not having access to services or being afraid to use those services will also have an impact on the citizen family members who might also be afraid to use services for which they're eligible. In terms of what healthcare leaders can do, I think a part of it is trying to still figure out where the bottom falls out in here. So in terms of with all these executive orders coming so quickly, kind of trying to see where the dust settles and figuring out, okay, what is the law of the land, or are these executive orders, can they be implemented? And then based on that, what sort of action can be taken in terms of how to shore up healthcare facilities and the healthcare system in general to make immigrants feel comfortable. Applying for health coverage, but also getting the health services that they need.
Okay. So thank you for this. This is a lot of information, very useful information, folks. But on a much broader context, I wanted to know if you could dive a little bit deeper in terms of, as you know, a lot of the hospitals in the local area here in Boston have been struggling financially. which resulted on many different layoffs across the state, and some hospital closures like Carney Hospital in Dorchester. And I think there's another hospital that is about to close as well, that deals with children with special needs. So from a financial standpoint, the hospitals are already struggling to sort of be able to raise enough revenue by way of providing clinical care to people, because some of them are limited in terms of what they can actually charge for certain services, right? So they're already struggling with that. In your views, how do you think that these executive orders, if these were to pass into laws, would have, what financial impact will they have on the hospitals themselves and their sustainability going forward? And in terms of the family unit, most people probably don't know, but when you're from, and I am from, an immigrant family and an immigrant community, so oftentimes we already carrying the financial burden of caring for several family members here and abroad. So if these folks are no longer able to get some sort of social support and financial assistance with insurance and that type of stuff, what does that mean for these immigrant communities in terms of their livelihood and their ability to self-sustain?
So in terms of your first question about sort of the impact of thinking about these executive orders for sort of hospital systems, to be frank, it could be detrimental in the sense that, if you have populations of immigrants that were eligible for certain types of coverage options through either the state of Massachusetts or through, some federal programs, for instance, those would be funding dollars that would no longer be coming into those hospitals. And so the ability to try to make up that financial gap would have a very negative impact on the, if you will, bottom line. For these hospitals. And so it would become a cycle whereby, these hospitals are trying to provide care, but they don't have the resources to do it. And the populations that would be coming are now afraid to come for care,
right.
Or either they're no longer eligible for the coverage options that could be used to pay for that care. And so it would really have a negative impact, financial impact on hospitals that are already struggling. You already mentioned staff, staff shortages and what have you, and the fact that, our healthcare system still has not fully recovered from the COVID pandemic. And so that's one piece.
What about population health outcomes, though? If they don't have the money to provide adequate care when needed, what does that do in terms of health outcomes for patients?
Yes. I mean, in terms of health outcomes, I think it would have a very dramatic and negative impact on health outcomes if people aren't able to get access to preventive care. So, annual physicals, to be able to kind of get a sense of what's going on with their bodies, to be able to catch things early, high blood pressure, elevated A1C levels, is an indicator of diabetes or other issues, then these things could certainly escalate and turn into more serious and severe health conditions. And so, the health outcomes, it would definitely have a very dramatic impact on health outcomes if people aren't able to get access to somewhat regular preventive services, but also specialty services. And going back to the executive orders that I was talking to, another one that I forgot to mention is that the Trump administration also signed an executive order that removes hospitals, courthouses, and schools as sensitive locations. So in the past, those locations were kind of considered to be hands off, if you will, for ICE enforcement or immigration customs enforcement. And so Now that those locations are no longer deemed sensitive, that means that ICE officials can go into those locations and be able to pick up and detain people from those locations. And so what that also means is that aside from the issue of, people maybe losing access to coverage, that the fear, that there is an elevated fear, an intense fear of going to these locations because people feel like they could be targeted and detained and likely deported from going to see their doctor for a medical appointment. One of the things that I found in my book that I wrote about in terms of immigrants' healthcare access during the last nearly decade is that the issue of fear was a very big deterrent of people from applying for coverage, even if they were eligible, but also from using that coverage to obtain needed health services. And so what I found in my study over the 7 to 8 years that I was doing the research is that as the socio-political climate became more explicitly anti-immigrant, how it was also more explicitly racialized and targeting a particular group, with Latinos often being singled out by the president and his supporters, Latino immigrants from Mexico or south of the border, if you will, that this led to intense fear around people just leaving their homes in general. And so in my project, in my research, I interviewed healthcare providers that work with immigrant populations. I interviewed immigrant and health advocates as well. And what I heard from both of those groups is that this fear basically caused people to just not go anywhere. They would stay home. They would not send their kids to school. They would not go for medical appointments. They would not go to work. And so it's really important that if people aren't getting, the preventive care that they need, if they're not able to stay on top of, let's say, for kids getting vaccines to be able to go to school and things like that, that has public health implications, that extend beyond these immigrant communities, but also has an impact on the larger society as well, then that fear of leaving home has so many broader implications that with this new executive order singling out or removing the designation of these sensitive locations, I think we're going to see immigrant communities and even citizens in mixed status families retreating from going to healthcare facilities for preventive services, but also even going to the ER when they have more emergent or more severe health issues. And so to put it simply, it's life-threatening. This is going to have life and death consequences for these communities, and it's something that we should all be concerned about.
What about from the second half of the question about community health? What about children that are from these communities, them attending school, being able to play outside like every other children? What can you say about that? What can you offer us?
So in terms of thinking about children, I think that they are very aware of what's going on. They are aware of the climate. They hear things from their parents. They sense things that are going on. And I remember doing some of my interviews with healthcare providers where they would, reference how they were seeing a patient and the child would be off in the corner, pretending to do a coloring book or whatnot, while the healthcare provider was speaking with a relative, an immigrant relative, about some of the fears and concerns around immigration that some of these patients had, and the children's, their ears would kind of be perked up listening and paying attention. And so what I've heard, in terms of some of my research is that, children are very attuned to what's going on. And so this also, starts to have an impact on their mental health, on their psychological, their emotional health, the stability or instability that this promotes, this sense of not knowing if when my parents take me to school in the morning, are they not going to be there when I come home? What's going to happen to me if mommy and daddy don't come home because they've been detained? So, this certainly, in terms of thinking about the mental health and the emotional health of the next generation has some long-term consequences. But to the point about school, I mean, it also has implications for educational outcomes, social mobility, and the ability for these children growing up in this climate to be able to contribute to the society in a productive way if they're experiencing this fear and anxiety, but also not being able to get a proper education as well.
Yeah. Thank you for saying that, because as I grew up here myself, and I remember how difficult it was back then when I was like around high school, elementary school, and other children were quite brutal towards me who came from Haiti. Back then, AIDS was rampant, and there was a whole narrative that was created around the island that's where HIV/AIDS came from when it wasn't. So a lot of us growing up from this community, we were called boat people, because at the time that a lot of Haitians were trying to migrate into the United States because of conflict back home. So I will say it did affect me personally as a kid, not feeling like I belonged anywhere. I didn't belong back home. I didn't belong here. I didn't really have a safe space. And it caused me tremendous mental anguish. It does alter the trajectory of your life in terms of educational attainment, in terms of the path you follow for education, and that type of stuff. So I'm really concerned about these executive orders and what toll they're going to take on kids in immigrant families, because I don't see this having a good outcome for them.
No, absolutely. And to go back to the point about schools no longer being sensitive locations and sort of this ICE notification of if you suspect someone's an undocumented immigrant anywhere, even in schools or churches or hospitals, this now turns teachers and classmates into, sort of this extended hand or surveillance hand of the government. And so it makes those places certainly no longer safe, and schools, which is where our children are spending a quite significant amount of time, if they're not able to feel safe there, or that they'll be viewed with suspicion, and a teacher or a classmate or the parent of a classmate could call and say, I suspect that this child is undocumented, or their parent. Again, sort of the health implications of that can be quite severe, I think. So the physical and mental health implications
For
of
sure.
that.
Yeah. So in your book, Not All In, you discussed how turning healthcare, or our administration is turning healthcare into a political issue. They're basically politicizing it. And it can make it harder for immigrants to access care. And I think you kind of touch a little bit on that from this conversation. So under this administration, policies like that attempt to repeal Obamacare or restrict immigration measures significantly, amplifying that, just basically barriers that already existed within our society, they're basically amplifying those barriers, adding to those as well. In your opinion, how have these events and policies already affected immigrant access to healthcare even before President Trump was elected, throughout the whole campaign? I know personally I've heard a lot of immigrant individuals who were very fearful about the outcome of this election. With healthcare becoming a highly politicized issue, what risk do you think this poses for immigrants under this new administration? You covered quite a bit of it, but beyond that, and I'll even go even further and say this has the potential to overflows to other populations that are not even immigrants.
Oh, absolutely.
So, like when you think about the order about birthrights, well, what does that mean to us who are ancestors, where our ancestors were Africans? But were born in this country. So there's a lot of domino type effects that could occur from something like that, especially if it's not done properly. So do you want to elaborate on that a little bit more
Sure.
from that perspective?
Sure. So I know you mentioned about the issue about healthcare being a political issue.
Yeah.
And I certainly, that's definitely not recent. I think this goes back to, even before the Affordable Care Act was signed into law under President Obama. And I still think, I can still remember that moment when then President Obama was addressing Congress. And he was talking about the Affordable Care Act and how it would not provide access to health care for undocumented immigrants. And the representative from South Carolina, Joe Wilson, shouted, "You lie," which had never sort of happened, when the president addressed Congress.
Right.
And so, that was maybe 2009 when that happened. And we're 2025. So that was 16 years ago. And so what we're seeing now is just sort of a continuation of an issue that has been politically fraught, from that point. With sort of the increasing exclusion of immigrants from a wide range of public benefits and social services in the United States that really started in 1996 under President Clinton, with immigration and health reform, and has since just kind of intensified moving up to this point. And so when we start to think about the debate around Obamacare, or the Affordable Care Act, which this year, in late March, will make 15 years from the signing of the legislation. When we start to think about the fact that the administration is proposing to, repeal, if not repeal Obamacare, which it tried to do in the first Trump administration unsuccessfully. But when we see things like ending the Medicaid expansion, or turning Medicaid into a block program, or letting the subsidies that people can receive through the exchanges to be able to purchase health insurance if they're not eligible for Medicaid. This is something that extends beyond immigrants, but will have a significant impact on citizens as well throughout the country. And so, this attempt to think about removing immigrants from public benefits that's been going on for decades now, we're now at a point where the focus is turning to citizens and removing them from having access to health care. And so before, when we talked about sort of the broader implications of these attacks, targeted attacks on immigrants, the lens is also now turning to citizens who legally, are supposed to have access to some of these things. But now that the potential of that is being taken away.
So is it really racialized more or less? Or, I mean, even with the executive orders, I can't help but to think that the people that will suffer the most from those are the Latinos and the blacks. But we also have so many different types of immigrants in this country.
Yes.
For example, Ukraine. So I don't see this extending to those populations.
So I think it depends on kind of how these changes get implemented. But, to your point about Blacks and Latinos being more likely to experience or being especially vulnerable to this, I would certainly agree with that because of the history of structural racism in this country and what we know in terms of the health disparities research, in terms of sort of the impact of centuries of, explicit legal discrimination, up until the civil rights movement. And then since that time when policies were overturned, although some of those policies were, under the Trump administration, those things could potentially change as well. But also sort of implicit, racial discrimination that people experience as well. We know that has had an impact on perpetuating disparities in health outcomes, but also in healthcare access. But these are things that could also affect other people just because, in terms of thinking about the executive order around birthright citizenship, for instance, that doesn't explicitly have any racialized language in it. So anyone, a Ukrainian person, who's here, they could, if they're, if this policy is implemented, and they are not here as a legal permanent resident or have not been able to adjust their status to be a legal permanent resident or to be a citizen, then that has implications for any children that they have that are born here. And so I think that's the other thing that I also write about in the book a little bit too, that a lot of these policies, we're at this point in our history in the U.S. where many of these policies don't include racialized language, but they have racialized implications that will affect certain segments of the population in more significant ways. But at the same time, if you're talking about legal status just across the board, then that is certainly going to cut across racial and ethnic groups. So it ends up affecting, or the language that's used, the race neutral language that's used, in these policies, it cuts across racial and ethnic groups and ends up targeting groups of people that, maybe the president and his supporters, for instance, might have wanted to target, or I should say, the president and his supporters might not have wanted to target, but those groups end up getting targeted anyway. So going back to the point around, if the Trump administration allows the subsidies to the ACA to expire for people, middle income people who pay for their coverage that way, or allows the Medicaid, significant changes to Medicaid, the Medicaid expansion, that's going to affect a lot of people who are lower income, who were white, in a lot of the states that voted for President Trump. Yeah. And so, these are issues that cut across racial and ethnic groups, even though, when the rhetoric or the language that we hear that's supposed to focus on particular groups, when we hear the term immigrant, it has implications for people who are not in that group that we might not have originally intended or thought were going to be included or affected by those policy changes. So I feel like these are issues that on the surface, people might say, well, I'm not an immigrant, or, I might be a descendant of an immigrant, but I'm a U.S. citizen now, or, I'm able to get my coverage through the ACA, those people might feel like they're not going to be affected by any potential changes right now. But based on, what I've been reading, these people could be targeted as well. Yeah. And so, again, I think that's why folks should, really be concerned about, even though it looks like immigrants are being targeted, citizens could be targeted in a similar manner. And to go back to what I talked about with regard to racialized legal status, and that's what I found in my book when I interviewed naturalized citizens of Brazilian, Dominican, and Salvadoran heritage. Many of them would say, I'm a U.S. citizen now, but I still feel like I'll never be treated and fully regarded as a U.S. citizen because I'm not white. Right. And so, again, even this notion of citizenship has racialized origins in terms of who could originally be identified or acknowledged as a citizen in this country. And even though citizenship has been expanded to include a larger group of people, there's still this perception of when people hear the word American, there's a particular phenotype or a particular type of group of people that come to mind. And it typically doesn't include people that look like you and or me.
Yeah, of course. Very true. So in your book, Not All In, you had a lot of personal stories. So you shared personal stories from your research that highlighted the real life struggles immigrants face when trying to access healthcare, particularly those affected by immigration status. Obviously, you kind of covered some of that. Could you share, and you have already shared a few, but some more stories? What was the most meaningful story for you in terms of this body of data that you collected that you were amazed by and you couldn't, believe it?
Oh, my goodness. I mean, I would say there are just so many things and so many moments from the interviews that I did over the years that just really moved me in particular ways. I would say one of the interviews that I did that stuck out to me was when I was interviewing an immigrant advocate who, and this was when I collected data or did interviews in 2015 to 2016, oh no, I'm sorry. In 2019, this particular interview, when I was interviewing an advocate who was sort of talking about sort of the intensifying anti-immigrant socio-political climate and its impact on healthcare access. And she gave the example of this immigrant family that had a really sick child that needed to get care and needed to go to the hospital. And this family was so afraid because of the heightened socio-political climate to call an ambulance to take their child to the hospital that they decided we'll just drive them ourselves. And the child died in the car on the way to the hospital. So the fear that this family must have felt, and again, this was, I think, exemplifies what I was saying about life or death consequences. It exemplifies that the fear that this mother and father felt so strongly about calling an ambulance that could have gotten their child to the hospital more quickly, that they felt that the calculated risk was that we're too afraid to do that. We need to try to take our child ourselves. And that was the outcome. And that story really stuck with me because I was just like, this is a child, and this child suffered unnecessarily. Who knows if their life probably could have been saved if their parents hadn't been so afraid to call for help and to be able to utilize, one aspect of the healthcare institution in terms of ambulances, for instance, which could have been able to get the child to the hospital more quickly. That the level of fear that family experienced, that was something that really stuck with me. I'm also reminded of another interview that I did, I guess probably in 2015 to 2016. And when I did those interviews, this coincided with the initial or the first presidential campaign of Trump when it looked like he was going to become the nominee. And one of the things that I was hearing in some of my interviews back then, even in Greater Boston, and during that year, I was hearing that Boston immigrants, were already starting to disenroll themselves from healthcare services, from other benefits and things. And these were documented immigrants, things that they were eligible for, entitled to by law, because they were afraid that if Trump won the election, that if their name was in the system somehow, that they'd received benefits, that could be used as a way to identify and locate them and target them for potential detention and deportation. And so, I thought about those interviews so much, after I finished that round of interviews in 2016, and then the election happened that fall and Trump won. And I just kept thinking about those interviews over and over again. And so in some ways, I feel like those interviews I did in 2015 foreshadowed what we've been experiencing and kind of seeing in Boston and across the country since that time. And we're in that moment again, at the start of this second Trump administration. And so I just, continue to think about the immigrants that I interviewed and some of the things they shared, the fear that they were living under. And I think a lot about the advocates and the healthcare providers who are doing their best to try to keep communities informed, to file lawsuits against the administration, who are doing everything they can to try to hold the line. And it takes a toll on them too. And so, even in my interviews, I would ask people, particularly the advocates and providers, how are you managing? How are you dealing with this? And some of them said it was just so stressful. I remember one immigrant advocate that I interviewed talked about And I interviewed this person in 2019 under the first Trump administration. And this advocate said that, with this administration, it's like a bomb going off every day in terms of the difference with the rhetoric, but the policy proposals and then the announcements, things on Twitter. And it was just really hard to get a sense of, okay, just sort of the chaos really made it hard to figure out how can we best support these communities when so many things keep coming at us. And I've been thinking about those interviews a lot over the last few days because it really takes me back to that time after the start of the first Trump administration, then in 2017, and when I did those interviews in 2019, 2 years later, and how advocates and healthcare providers were still trying to figure out what is the best way that we can try to ensure that we are able to continue to provide care for these populations who need it. And I think they understood, similar to what I was saying before, that, immigrants are the target, but this could easily have an impact on citizens too.
Right.
So if we're not concerned about what happens to these immigrants and we're not doing what we can to hold the line for the most vulnerable among us, then what happens or who will be there to advocate for us when the focus then shifts to us? And it also reminds me of what was it, I forget, during World War II, that poem that's often recited about, when they came for this group, I didn't speak up because that wasn't my group.
Right.
And then when they came for me, there was no one to speak for me. And so I feel similarly about, the issue around the vulnerability of immigrants and how, the way that the most marginalized and the most vulnerable of us are treated. We have to be advocates for them because we could someday be in that position and there won't be anyone to advocate for us.
As we are ending the podcast, it's been a very informative conversation. I'm so excited that you came to meet with us today. I was wondering, is there anything that you want to say? Do you have any call to action? And of course, we want everyone to pick up a copy of your book, Not All In, by Dr. Tiffany D. Joseph. When is this coming? When is it being released?
So it's available for pre-order now on the Johns Hopkins University Press website. Official publication date is March 18th. March 11th, which is a couple of weeks before the 15th anniversary of the signing of the Affordable Care Act, which is March 23rd. So, I think at this point, in terms of thinking about where we are 15 years from the signing of the ACA and what potential changes could be coming, I think the book does a really good job of sort of showing the impact of health reform in terms of sort of populations that were left behind, but also trying to think about how can we make health reform better and more inclusive going forward.
Okay. And where can people pre-order the book?
So people can pre-order the book through the Johns Hopkins University Press website. You can also find access to the book or information about it on my personal website at TiffanyDJoseph.com. There's a link with the book to pre-order it. There's also a code to get a 30% discount.
Very nice.
On my personal website. And so those are places where you can pre-order the book.
Okay, well, I'll make sure to pre-order a copy for myself.
Okay,
but
great.
I'm going to need you to autograph it, though.
Absolutely, I'll be happy to.
Well, thank you, Dr. Joseph, for coming to BG today. It was a great conversation. I hope to see you again.
All right, thank you so much again. Pleasure to be here.
Thank you.
Keep your soul